As the pandemic began, what were some of the resource inequities that the Native nations faced, yours in particular, that put members within the nation at a disadvantage?
Here on the Navajo Nation, not everybody has running water. A large population is still hauling water for their livestock and also for the household use. So when the CDC and the federal government and we as leaders tell our constituents, our citizens to continuously wash their hands with soap and water, um, sometimes we just don't have that amount of water to do that on a periodic basis.
In terms of the epicenter, Suffolk County now has become the epicenter. That's the county that we're in of New York. And part of the reason for that is because so many of the city people have come out here to the Hamptons to get away from the city. They have their homes out here in the Hamptons, and it has brought with it the virus. It has brought with it empty shelves in the stores. So it's been quite a dilemma for us who live here year round, because most of the time they only come out during the summer. One of the first things that we did is we set up a food distribution tent, to provide food for our people, so that would hopefully limit the amount of our people having to go off res to the grocery stores and to town or to some of the other towns to purchase food. And I was on the food line one day when we got the middle of it, when it really started getting bad out here. And that's the first time that I saw fear.
What about broadband? I know that's a significant issue across Indian country.
Here on the Navajo Nation, we don't have the best internet access by high speed. I'm fortunate to be in the Navajo Nation capital, where we got some good cell service. So I'm on cell service right now, and throughout the Navajo Nation, there are dark spots throughout many areas. And so when schools are canceled, university and college students are told to go home and do online courses, it's a concern for us, because I hate for our youth to fall behind in their studies. And I know high school students are being told to do online courses as well. But here on Navajo, we don't have the best high-speed internet. But you know what? We are doing hotspots throughout the Navajo Nation, working with some of the carriers, some of the companies here, maybe 12 or so hotspots throughout the Navajo Nation, so that students can go to these parking lots during the day, not during the lockdown, but during the day, so that they can catch up with their work.
Can you shed some light on the health disparities that some of the Native nations have faced since this pandemic has hit those communities a little harder than some?
In many tribal communities throughout the country, or even in people of color communities, there are high rates of diabetes, cardiovascular disease, and a lot of health problems. Here on Navajo is no different. I think this last statistics I got from the diabetes group here is that 1 out of 4, 1 out of 5 have diabetes in Indian country, and that's alarming. And those individuals are in that category, the most vulnerable population. And so we need to care for them. A lot of them are elders as well.
As the pandemic spread, I understand that both the Navajo Nation and the Shinnecock Nations had some issues with regards to receiving funding from the federal government. Can you shed some light on some of those issues you've had?
When you say you're from New York, there's automatically this notion that you're a city tribe. And we just had that in discussions with IHS, Indian Health Services, where they were sending the Abbott ID Now testing analyzers for the COVID virus here. And they sent them to every tribe around us. And when I called to inquire why, they said, well, you're not a rural tribe. And that is really misleading, because we absolutely are a rural tribe. But as soon as you say New York, there's this automatic perception that, you're in the city or you're by the city, and that's not the case. They told us that they go by zip code. because I called up. I was on one of the White House calls, and then I was on one of the IHS calls that they've been having every week. And I was inquiring. I said, we're in the epicenter of this here. It was definitely frustrating for them to have classified us without even talking to us.
And how about you, President Nez?
We had 3 legislations that were approved by Congress and signed into law by the President of the United States. And we haven't seen much of that at all in an Indian country. And so, we're not going to just feel sorry for ourselves and roll over. We're going to say we're going to utilize our own resources and our own laws here on the Navajo Nation. We're a sovereign nation. We had to appropriate $4 million of our own money to help out with the emergency operations here. But don't get me wrong, I'm going to put all the receipts together and send them back down to federal government, make sure that we get our compensation, and the money, as you know, is for the citizens of this country. And it seems like, once again, I hate to say, the first citizens of this country have always and are being ignored right now in this pandemic that's sweeping across this country of ours.
Is the pandemic bringing to light any other challenges that Native nations, particularly yours, are facing when it comes to receiving funding and other forms of resources?
We had to apply to CDC because the money that was allocated to tribes, they go to the federal departments, the federal agencies, CDC, BIA, IHS, and we have to use the same process. Tribes have to use the same process as we do every year when federal monies get appropriated. And it's an emergency. They should be going directly to these tribes, tribal governments, just as they are going to the states, the counties, and municipalities out there. But yet we have to develop a whole packet and submit it as a grant application.
The states and the counties just get it automatically, but we have to go through. I was just looking at some of the paperwork, and you have to give your budget, your numbers from last year, your expenses and everything from last year, from 2019. So there's a number of different documents that we have to put in, and then we don't know how they're going to disperse this.
How can some of those challenges be better? In particular, what is your nation doing to alleviate some of those issues?
By raising the awareness of the issues in tribal communities throughout the country. Your tribe, my tribe, all 500 plus tribes throughout the country. And I see that people are now recognizing that there are regulations, laws that are barriers to getting finance dollars to tribal communities, those resources. And it takes a very long time. Sometimes we as tribal leaders, we have to shout loud, and that's the only way to get the attention of the government that we're supposed to have a nation-to-nation relationship with. And so when we signed that treaty, we recognized that we had a partnership with the federal government. We said, United States of America, if you're ever in trouble, we will back you up. Those broken promises from the federal government towards the tribes is numerous. But here, for Navajo specific, and I'm sure your tribe too, we've helped the United States of America in many ways. Look at our code talkers in our communities. Look at even the help that we're doing right now with our latex glove manufacturing facility here on the Navajo Nation. Getting the PPE equipments for our healthcare facilities and our doctors and our nurses, and not just here on Navajo, but all across the country.
It's one of the reasons why, tribes are out here trying to become economically self-sufficient. You have gaming tribes, you have tribes with the oil reserves. You have tribes that are out here trying to make themselves economically self-sufficient so that you don't have to be reliant upon these governmental funds, but then there's a big but in there. We also know that the federal government has an inherent trust responsibility to the tribes.
We've all gone through some trying times as a people, indigenous people in this country. And here's an opportunity to share that with our younger generation, to know that we are strong and we're resilient, and this COVID-19 is not going to sideline us.